For many people, nothing comes close to the joy and excitement you feel the very moment you hear you're going to be a parent.
Month by month, you follow the development of your child still in the womb. Then you start decorating the nursery, picking out baby names, making big plans for that little bundle of joy.
But sometimes complications can turn such sweet moments into something that's downright scary. For one woman, they were complications that still have her in the fight of her life.
It's only human to ask why. Why it happens to you, why it happened to her.
26-year-old Jenna Hinman was 30 weeks pregnant with twins when she suddenly couldn't breathe.
And I actually got down next to her, so her stomach was on me, so I could feel it. And then it got really intense with her screaming.
Her husband, Brandon, a soldier at Fort Drum, called 911, and doctors quickly realized she needed an emergency C-section. She gave birth to twin girls, weighing 3 pounds each, but she still couldn't breathe and started coughing up blood.
Her lungs are so involved with tumor that they don't work, and right now they're not working at all.
What Jenna didn't know during her pregnancy is that she's suffering from an extremely rare form of cancer called choriocarcinoma. It forms in the placenta.
If you ask how many of those patients come in like Jenna with such acute illness, then it's a lot less common than 1 in 160,000.
She's been placed in a medically induced coma and is getting heavy doses of chemotherapy while a machine breathes for her. It's been touch and go day by day, but doctors did recently wake her up for a brief moment.
I walked up to her bed and I grabbed her hand and I said, "Honey, it's me. I love you. You're doing great." And as I was talking, she shook her head yes.
There was Brandon telling Jenna that the 2 babies were doing okay. And at least in that moment, we had a family.
That could be the last time I talked to my wife, so it was amazing. It won't be, but
Jenna's twin girls, Kinley and Aslan, are doing just fine. In fact, they're helping to garner support for Mom. On the Facebook page Prayers for Jenna, you can see Kinley with a sign that reads, "Hi, I'm Kinley. Please pray for my mommy." And Aslan says, "I may be very small, but I know that your prayers are mighty."
How about that? Well, as we heard, Jenna's case is extremely rare, discovering cancer relatively late in a pregnancy. But there are other complications that can arise.
For some people, just trying to get pregnant can be quite a struggle. Joining us today to shed some light on this new medical advancement is Pam Fleckenstein, women's health clinician at Laurel Family Medicine and satellite office of Peninsula Regional Medical Center. Thanks for joining us this afternoon. Let's start with Jenna's situation. This cancer was caused by her pregnancy, right?
It was caused by part of the pregnancy,
Okay.
the placenta. The chorion is part of the placenta that for some reason, don't exactly know why, cells mutate, become carcinogenic, and there tends to be a propensity to metastasize to the lungs.
Wow. Now we say it's rare.
It's very rare.
Is it really rare?
I've seen choriocarcinoma maybe 3 times in the almost 40 years I've been involved in women's health care.
Really?
Well, what are some of the complications that can develop that can come as a result of being pregnant?
Oh, there's multiple complications that can happen. We hope that none of them do. Things like gestational diabetes, I think you have that mentioned. You mentioned that. That's common. High blood pressure, preeclampsia. Those are the more common complications that happen.
What about women who have IVF, in vitro fertilization?
IVF puts women at risk of complications more often because there's multiples. There's more than one baby sometimes sharing that uterus. And the more you have, the more complicated it becomes. There's a lot of issues around that.
Well, while we're talking about complications, people having trouble getting pregnant, there's a lot of stress comes in. Is stress a factor too?
Yeah, that was just recently brought up on one of the news shows talking about stress. Well, stress affects your hormones, particularly the hormone cortisol, which can then affect the reproductive hormones, either telling them to shut off the ovaries so you don't ovulate, or, it can cause other complications, maybe overproducing eggs or something. We're not sure exactly, but we know stress is definitely a factor in women not being able to achieve a pregnancy. You've all heard stories about people that adopt babies, and that soon after they've adopted a child, they get pregnant.
pregnant.
They're relaxed. They're not thinking about a pregnancy anymore, and all of a sudden it happens. That's because those stress hormone levels are down.
And just days ago, we heard this story about a woman who was having stomach pains. She goes to the hospital. She's 9 months pregnant and delivers a 9-pound baby. She didn't even know she was pregnant. How does this even happen?
Denial. That's how it happens. No, a lot of women are not educated enough. Some of them are young, you know, and they're just not educated enough to realize the signs and symptoms of pregnancy. You know, it amazes me still that women, you know, tell me they think they had gas when they're in labor having a baby, that all that movement was just gas in there. I can't conceive of that personally.
Oh my goodness.
But it does happen. My neighbor across the street had gained some weight, and I went over to ask her if she could babysit. She was in labor. They called the ambulance, and they told the ambulance crew she was having stomach pains because they didn't want everybody in town to hear it over the monitor.
Oh my goodness.
The doctor that I work with, she had an employee that weighed 102 pounds that had an 8-pound baby and hid the pregnancy the whole time. I said, how can you hide a basketball?
On a 102-pound woman.
On 102,
That's something.
and she said, well, she looked like she was gaining weight. I said, yeah, I guess she was, but she had no prenatal care. It was, you know,
Which is not a good thing.
No.
While I've got you here, let me ask you this question. There's been so much debate lately about mammograms, when they should start, how often they should be. What's your take on that?
well, I have a personal bias, I guess, in that they should start at 40. I still order mammograms starting at age 40. But the way they're looking at it, I guess, well, the American Cancer Society holds one view, and then there's another group that holds another view. You know, the younger the woman is, often more aggressive the cancer is. So I'm for early screening. We know if you have a family history of breast cancer that you should be watched more closely, particularly if someone in the family is positive for the BRCA1 and 2, the BRCA1 and 2 gene. There's a good test for that. We don't recommend everyone be tested, but it is good to know if you have a family member or a strong family history. We watch you more closely. We start mammograms earlier. But starting them at 50 is more of an economic thing, I think. It's like if you screen 100 women and you pick up one abnormality, then they'll think that the 99 that were cancer-free didn't need to be done.
Right.
So it's kind of cost and benefit is the way I think some of them are looking at it.
Pam, thank you so much.
You're very welcome.
All very
My
good
pleasure.
information as usual. And to read more from PRMC, go to our website, delmarvalife.com, and click on the show tab. For many women, their mammogram brings them news they're just not prepared to hear. They have cancer. Up next on Delmarva Life, a story of survival. One woman sits down with us to tell us what it's like battling stage 4 breast cancer.
We're also going to hear how support from the community can mean so much to those fighting cancer and how you can get involved. But first, Pam touched on how diabetes can affect pregnancy, but anybody can develop the disease. Dr. Oz has more on what you need to look out for.
Hi, I'm Dr. Oz. 7 million people in the U.S. have undiagnosed diabetes. Symptoms can include excessive thirst, hunger, fatigue, and weight loss. Also blurry vision and pain or numbness in your hands or feet. Now, your doctor can make a diagnosis using a simple blood glucose test. It's a finger stick. Why not?